Today we're joined by Dr. Michael Farzan, who's professor, co-chair of the Department of Immunology and Microbiology at the Florida campus of Scripps Research. Thanks so much, Mike, for joining us today.
Thanks for having me, Rowena.
So I am under the impression, I think a lot of the country's hearing a lot about antibodies lately. We're hearing them about antibody tests are becoming increasingly available. We hear about vaccines that are designed to induce antibodies. We hear about people in hospitals who are being treated with convalescent plasma because it contains antibodies. And antibodies, they're kind of a complex topic. So I want to unpack this step by step. And so why don't we start off with what are antibodies?
Right. Antibodies are proteins that your body makes, but they're a very unique category of proteins because you make a number of different variants of them, on the order of billions of different variants of them. And what happens over time, you develop higher and higher, tighter and tighter antibodies for the virus. And this is really a central part of your body's immune response to the virus, and absolutely critical for the vaccine as well.
And so what are the roles of antibodies with this infection? Do we know yet whether antibodies help people to clear this particular coronavirus infection?
Well, yes, we do. We know it in a variety of different ways. We know it from animal studies of SARS-1, for example, SARS coronavirus 1, the 2002-2003 SARS outbreak, very closely related to this current coronavirus. And we know it from a number of studies using convalescent sera. So if you take antibodies from a person who's had the virus, and those antibodies are relatively good, and you infuse it into somebody who could be quite sick, that individual typically does well.
Okay, I did want to ask specifically about this convalescent plasma.
Mm-hmm.
And so this is, as you describe, a situation where you're purposely infusing somebody else's antibodies into a person,
Yes.
hoping that you can use that as a treatment to get the sick person well again. So how is that different from a vaccine?
It's the most important difference is this approach is immediately available. So let's start there. The second most practical difference is it is not like not scalable. In contrast, a vaccine and passive infusion of laboratory-made antibodies are scalable. We can make a lot of it and distribute it to many, many people. So I would describe the use of convalescent sera as a stopgap measure, but nonetheless an extremely important one in this time frame where we don't yet have large antibodies at sufficient scale to be distributed, and we don't have a vaccine.
Can you imagine a situation where a person gets this coronavirus and they recover, but the antibodies they make are either less numerous or less effective than somebody else's antibodies?
Oh, easily. We already have data from studies that shows that some individuals do not, even after what appears to be a reasonably serious infection, make what we call neutralizing antibodies. So there will be a wide range of quality of convalescent serum. And indeed, that's what we and a lot of other sciences are trying to do, is to get easy ways of measuring and predicting whether a sera will be good or bad, and find those kind of superstar sera, because individuals who would volunteer might be able to donate their blood every other week or so, and that could be extremely helpful. So finding those individuals would be quite good, and getting rapid ways of predicting whether a sera will be good is an important priority.
And you know what is occurring to me is that there are lots of people now out there who've had coronavirus and they've recovered, and they're hearing that they're now protected from infection. And that, from what we're talking about now, is not actually necessarily the case. If they didn't make a lot of antibody, or if they made antibody to the wrong part of the virus, it's possible maybe that they're not as protected as they might be under the impression.
This is definitely one of the concerns. I'm a little bit more optimistic about that for a variety of reasons. Number one, you have a number of immune mechanisms that can accelerate an immune response even if your initial antibody response is not what we would say potently neutralizing. It doesn't block the virus straight out.
And I think we need to clarify too, because we're hearing a lot about antibody tests coming out, and those antibody tests are not telling people whether they have neutralizing antibodies. They're telling
No,
people if they have
absolutely
any
not.
antibodies.
Right. So the typical targets of these tests are a protein called nucleocapsid, or the N protein, or a protein called spike, or the S protein. So any antibody against the nucleocapsid is essentially useless, except as an indication that you have been infected.
I know that you've been doing research, or at least a couple of weeks ago, you published some research. We're getting kind of to the most complex part of this whole story about antibodies now. And we might need to take a little minute or two to unpack all of these details about antibody dependent enhancement. And
Right.
so certainly, we're used to thinking of antibodies as a good thing, and by and large they are. They can protect us from infection. They can help us clear infection once it happens. We can see that vaccines are trying to make antibodies. We use convalescent plasma to treat people because it has antibodies. And yet, there was a question about whether in this disease, antibodies might play a negative role. Can you say something about that?
That's absolutely true. So let me step back and say there is a lot of experience with other classes of viruses, and notably the flaviviruses like dengue virus and Zika virus, in which antibodies can actually, under certain circumstances, increase the efficiency of infection. And what we've been able to show in that paper is that when you do focus on the primary neutralizing epitope, you do not get antibody-dependent enhancement.
Now, I can't resist asking you, so I've known you for a while, you're an HIV researcher, and now, of course, you're working on this coronavirus. What do you think you've learned in HIV that has helped you move your coronavirus research along?
Well, actually, it worked both ways, because we did a good deal of work on SARS-1 in a previous era. So the compare and contrast between the two viruses has really been illuminating. It really shines a light on the different strategies that different viruses have to take. The ease with which we probably can make a vaccine against SARS coronavirus 2 strikingly contrasts with the inability or the very great difficulty of making a vaccine against HIV.
Well, I mean, it's true. You never know what you're going to learn in one area of science that's going to help you in some other one. My impression from you is that you seem quite optimistic when it comes to this virus. Boy, we hope you're right. I want to thank you very much for spending time today and telling us all about antibodies. Thanks.
Sure, my pleasure.